Joining us at 5, I'm Chris Harapsky. Right now, millions of Americans are now facing higher health insurance premiums after federal subsidies expired as we started the new year. It means those costs are set to skyrocket for people who get coverage through the Affordable Care Act, also known as Obamacare. For some, it means choosing a lower quality insurance plan, while for others, it means going without insurance altogether. In 2025, lawmakers did not extend the subsidies, which the Biden administration enacted in a pandemic relief package. The House is expected to vote this month on a Democratic proposal to extend the credits another 3 years, but that plan faces significant hurdles in the Senate. Another more specific kind of insurance plan is also being terminated in Minnesota, and people who rely on it, there are currently no options yet. Jennifer Hoff is here with more on what's happening with this. Jennifer.
Chris, it's called the Special Needs Basic Care Plan. It rolls both Medicare and Medicaid benefits and any others all into one encompassing plan. But the original provider, facing its own financial pressures, is scaling back what it can offer, meaning some people with disabilities now can't afford some of their most expensive medications.
The health insurance marketplace is already confusing. Add in significant changes this year, and it's even more so, especially for people like Rebecca Mallory, whose needs can be just as complicated.
Stressed, really stressed.
Mallory lives 2 hours north of Minneapolis, and despite several disabilities, works part-time, relying on medications worth thousands of dollars she says are no longer covered under her plan. The Department of Human Services says was terminated today in mostly rural counties.
What are you going to do now as you start the new year?
I don't know.
Her plan is very specific, rolling every medical assistance benefit into one, including Medicare and Medicaid.
When it's not integrated like that, it gets really confusing to both the clinics or doctors or providers. And I've got medications that have to have prior authorizations and big old approval processes, and they're coming due, and I've got nothing at this point.
The change happening after Medica recently acquired UCare, that's facing its own financial struggles and cutting back services, forcing people like Mallory to find new options through the state's online shop that she says hasn't provided any answers since this news broke last fall.
There's no news at all. It just keeps telling us to check back to the website later.
The plan has provided Mallory peace of mind for 20 years, running seamlessly the whole time, leaving her now in limbo instead.
Nervous and frustrated, yeah.
Lots of emotions for her tonight, and we have reached out to the Department of Human Services. In the meantime, there are other statewide networks available like Disability Hub and Aging Pathways. Those are free resources meant to help people like Rebecca, Chris, who are navigating what is a very confusing time for people, and frankly, as time is running out for some of them.
Yeah, and for people on private and work insurance too, who also saw their premiums go up.
Right.
Thank you, Jennifer. Appreciate it.